Welcome to the Omni Dental Podcast. All right, let's dive in. Here on the Deep Dive, we basically take source material, articles, notes, whatever you give us, and, well, we unpack it. We look for those key insights, the things that really matter, to help you feel genuinely informed. Today, we're tackling something maybe you think is just about looks, cosmetic dentistry. But the sources we have suggest there's way more to it than just a pretty smile.
That's exactly right. The material we're digging into today comes from Omni Dental of Arlington Heights. We've got info about their practice, sure, but the core of it is really about these often overlooked benefits of cosmetic treatments, benefits beyond the aesthetics. Our mission here is to unpack what that really means if you're considering these kinds of procedures, going beyond just the surface.
Okay, and just so everyone knows where this info is rooted, Omni Dental, they're located at 305E Rand Road in Arlington Heights, Illinois.
Mm. And the materials note they serve Arlington Heights, obviously, but also nearby communities. Let's see. Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village, too. They're presented as, a trusted family practice, comprehensive care, which kind of makes sense when they talk about treatments that mix looks and function.
Right, so maybe you're thinking cosmetic dentistry, that's just like super white teeth, perfect veneers, purely vanity. But these sources, they really push back on that idea. They argue the effects are, well, deeper, affecting your mental state, your health, how you function day to day. It's not just minor stuff. They suggest it can be pretty transformative. So let's get into it. What's the first big benefit the sources point out that isn't just about looks?
Well, interestingly, the first thing they really emphasize isn't physical at all. It's improved confidence and mental health.
Okay, yeah, I can sort of see that. If you like your smile, you feel better. But
Yeah.
how do the sources flesh that out? How does, say, fixing a chip actually boost confidence? Seems like a bit of a jump.
It's presented as a kind of cascade effect, really. Procedures like whitening, bonding, veneers, they address things people are self-conscious about. And when you feel genuinely better about your smile, well, you use it more, right? You're not trying to hide it.
Makes sense.
And the sources suggest smiling more isn't just, a facial expression. It actually triggers things internally. They mention research suggesting the act of smiling itself can release feel-good chemicals in the brain.
Oh, okay.
So you look better, you smile more, and that actually makes you feel better. It's a positive loop.
So there's like a physiological link there, according to the sources, not just a vague feeling.
Exactly. The idea is if you're not constantly worried about or trying to hide, say, stained or damaged teeth, you remove a source of anxiety, which then lets you, engage more freely in social situations.
Yeah, I definitely see that. Holding back a laugh, covering your mouth if you're worried. So the sources say cosmetic work can kind of liberate you from that worry.
That's the idea. They talk about a nice smile, reducing social anxiety, making communication smoother, both personally and professionally. Because you're not distracted by that self-consciousness. You might seem more open, more approachable.
Okay.
It's about taking down an internal barrier, basically.
So, wow, it's not just skin deep. It can actually change how you feel about yourself and then how you interact. Think about that, listeners. How feeling truly good about your smile could change how you approach, well, anything from meeting new people to speaking up.
And then moving from the emotional to something more concrete, the sources also really focus on stronger oral health and hygiene.
Okay, now this is where I get really interested. Because cosmetic usually sounds like the opposite of health necessity. How does fixing a gap, something for looks, make your mouth healthier? Are these procedures sometimes medically beneficial too?
Well, the sources don't quite label them necessities across the board, but they definitely stress that many cosmetic procedures have real functional and protective health upsides. They explain that fixing things like gaps where food gets stuck, or chips that could get worse, or even slightly crooked teeth that are tricky to clean, you're actually creating a better environment for your oral health.
Okay, give me some examples from the material. How do they protect teeth?
Sure. So dental crowns are a good one. Yes, they restore the look, but their main job is often to strengthen a weak or broken tooth, prevent it from cracking further or decaying more.
Right.
And things like bonding for chips or even implants for missing teeth, they all help protect the adjacent teeth and gums from damage or stress.
So it's like preventative maintenance that also happens to improve the aesthetics.
That's a great way to put it, based on what the sources say. By fixing weak spots and closing gaps, you're lowering the risk of future infections, decay, more serious problems. The material is pretty clear. When teeth are lined and intact, without those little traps for bacteria, Brushing and flossing just work better. They're easier and more effective.
And easier, better cleaning means.
Means better overall oral hygiene. Less plaque, healthier gums, lower risk of gum disease. The sources really underline this. The stuff you might think is just for looks is actually setting you up for better long-term health.
That's definitely an aha moment.
Yeah.
It totally changes the calculation. And speaking of value, some people might think these treatments are just temporary fixes. Do the sources address that? Talk about long-term value.
They absolutely do. The info we looked at emphasizes durability. Many cosmetic procedures, especially restorations like crowns or implants, are designed to last. They mention crowns and particularly dental implants aren't just short-term fixes. They can restore full bite function for, years, decades even.
Meaning you can actually eat properly, speak clearly, smile comfortably, without worry.
Precisely. The sources really zoom in on dental implants as a key example of this long-term function. They're presented as a permanent fix for missing teeth.
Not like dentures or something temporary.
Right. And the sources list key advantages for implants, like they help keep the jawbone healthy, preventing that bone loss you get with a missing tooth.
Okay.
They're described as super stable because they actually fuse with the bone. So unlike dentures, they don't move around.
Got it.
The implication is pretty strong. This stable, long-lasting function means fewer dental problems down the road related to that missing tooth space, saving time, money, discomfort.
That's a huge practical benefit. It really frames things like implants as more of an investment in function, not just appearance.
And naturally, these improvements, the confidence, the better health, the restored function, they ripple outwards. The sources point to positive effects on social and professional life as another major benefit.
Okay, we touched on the social anxiety a bit. But how else do the sources say a smile impacts things, like socially or at work?
They're quite direct about it. A bright, healthy smile often makes a really good first impression. Socially, they suggest it makes you seem more friendly, more open. It connects back to that confidence thing. Feeling good makes you share your smile more, which signals warmth.
And professionally, does a smile really matter there?
The sources suggest it can, yeah. Obviously, skills and experience matter most, but they argue presenting yourself confidently, which includes smiling openly, affects perception. Feeling good about your smile might help you project more confidence, maybe even trustworthiness. They mention treatments like whitening, veneers, bonding as ways to get relatively quick, visible improvements, which can then boost how you present yourself, potentially leading to better interactions everywhere. The takeaway seems to be that feeling better about your smile makes people more open to conversations, networking, new opportunities maybe they'd have avoided before.
So it comes back to your smile being part of how you show up in the world. And cosmetic dentistry, according to these sources, helps you feel freer to be your best self.
Now, anytime you look at treatments like these, obviously, questions come up, nuances, and the Omni dental sources do touch on some of those.
Good. Is there a difference between aesthetic and cosmetic dentistry? I feel like I hear those terms used the same way sometimes.
They do draw a line, and it seems important based on the material. Both aim to improve how your smile looks, yes, but they define cosmetic dentistry more broadly. It integrates beauty and function, so they put crowns, implants, bonding under cosmetic because they fix things and restore function while looking good.
Okay.
Aesthetic dentistry is presented as more purely focused on the visual, like whitening or maybe veneers just for appearance, often on teeth that are already healthy. So cosmetic, in their view, is kind of the more comprehensive blend of form and function.
That helps clarify things. It reinforces that health aspect again.
Yeah.
Did the sources mention anything about, the future of this field?
Yeah, briefly. They paint a pretty positive picture, talking about better materials, digital tech, more personalized treatments, maybe using AI down the line. The focus seems to be on procedures giving great long-term results, looking good and working well, aiming for more predictable outcomes, more personalization, better support for overall health, and hopefully, things that might eventually reduce treatment time or cost.
Sound promising. But okay, you mentioned nuances. The sources were mostly positive, but they did raise a flag about veneers. Something about a dark side. What's that about?
Yes, and this is really important. They emphasize informed consent here. Veneers can look amazing, obviously, but the procedure usually means removing a thin layer of your natural tooth enamel first.
Permanently.
Permanently. Once it's gone, it's gone. And the sources warn this can sometimes lead to increased tooth sensitivity. Plus, they stress that if veneers aren't done perfectly, or if you don't care for them well, or if the tooth underneath isn't totally healthy, well, it could potentially harm the natural tooth.
So, great results possible, but it's not something to jump into lightly. The health of the actual tooth underneath is key.
Absolutely. The material strongly advises finding a really skilled, experienced cosmetic dentist who cares about your long-term oral health overall. They emphasize needing a full discussion about all the pros and all the cons, the risks, everything for the specific situation before you commit to something permanent like veneers. It's about making sure the choice helps both the look and the health of your smile for the long haul.
Wow. Okay, this deep dive, using the sources from Omni Dental of Arlington Heights, has really shown there's so much more to cosmetic dentistry than meets the eye. It's definitely not just about a pretty smile. We heard how the sources link it to confidence, mental well-being.
And real improvements in oral health and hygiene.
Yeah, plus that long-term value, the restored function, and even how it can impact your social and professional life.
The source material really makes a strong case for looking at these treatments much more broadly. They seem like tools that blend looking better with real functional health and emotional benefits, contributing to overall well-being.
So if you've ever thought about cosmetic dentistry, maybe just dismissed it as elective or superficial, this look at the sources might shift your perspective. Think about those points, the confidence link, the surprising health benefits, the long-term function. Why might those non-aesthetic things be particularly important for you?
And here's a final thought, drawing from these materials. Consider how fixing or optimizing something seemingly small, like your smile's appearance and function, could actually create these unexpected positive ripples through your whole life. Improving quality of life, maybe opening doors, enhancing well-being in ways you hadn't even considered. It's definitely something to think about.
That really is a thought-provoking place to end. Thank you for joining us on this deep dive into the wider world of cosmetic dentistry, based on the insights from our source material. We hope it's given you a new way to look at the topic, and maybe encourages you to explore it more yourself.